सर शुरू करें?
हाँ शुरू कीजिए।
टाइम हो गया।
ओके
जी सर। मैं डॉक्टर धनेश्वर कुमार प्रिय आप सभी को प्रणाम करता हूं और IFPH के द्वारा प्रायोजित निरंतर प्रतिदिन वेबिनार के 244वें दिन आप सभी का स्वागत करता हूं। इससे पहले कि हम सब कार्यक्रम को आगे बढ़ाएं, हम सब 1 मिनट के लिए मौन होकर प्रार्थना करते हैं। हमारी आज की मेहमान डॉक्टर श्वेता सिंह जी हैं, जिनको मैं आप सभी से इंट्रोड्यूस कराना चाहूँगा। मैम होम्योपैथी में MD और PhD स्कॉलर हैं। CCRH नई दिल्ली में सीनियर रिसर्च फेलो के पद पर कार्यरत हैं। ऑर्बिट क्लिनिक में सीनियर कंसल्टेंट हैं। इन्हें 10 सालों का अनुभव प्राप्त है। दिल्ली होम्योपैथिक मेडिकल एसोसिएशन की पहली महिला प्रेसिडेंट हैं। KHA होम्योपैथी स्टडी ग्रुप USA की चीफ एडमिनिस्ट्रेटर हैं। इन्हें बहुत सारे अवार्ड से सम्मानित किया गया है। हाल ही में इन्हें लेजेंडरी होम्योपैथी अवार्ड उत्तराखंड के हेल्थ मिनिस्टर श्री धन सिंह रावत द्वारा दिया गया है। मैं डॉक्टर श्वेता सिंह जी का पूरे IFPH परिवार की तरफ से IFPH के प्लेटफॉर्म पर स्वागत करता हूं और आज के विषय पर अपना लेक्चर देने के लिए आमंत्रित करता हूं। मैम शुरू कर सकती हैं मैम।
थैंक यू सर, थैंक यू फॉर दिस ब्यूटीफुल इंट्रोडक्शन। और मैं बहुत बहुत धन्यवाद करना चाहूँगी डॉक्टर MK साहनी सर का और उनकी पूरी टीम का मुझे यहाँ आमंत्रित करने के लिए, और जो भी मेरा क्लिनिकल एक्सपीरियंस है इन स्किन डिजीजेस वो आप सभी के साथ साझा करने के लिए। तो थैंक यू सो मच सर एंड योर टीम। शैल आई शेयर माई?
यस मैम।
Please allow me to share my screen.
मैं कर रहा हूँ।
जी
श्वेता जी आपका पोस्ट हो गई, आप अपलोड कर सकती हैं।
जी सर। I hope this is visible to all.
हाँ विजिबल है, विजिबल है।
विजिबल यस।
Yes. तो स्किन केसेस में जो भी एविडेंस बेस्ड होम्योपैथिक ट्रीटमेंट हम देते हैं, तो वही केसेस विद एक्सप्लेनेशन मैं आप सभी के साथ आज शेयर कर रही हूँ। सबसे पहले डर्मेटोलॉजी इज बेसिकली ब्रांच ऑफ मेडिसिन which deals with skin diseases, hair and nail problems, both the medical and surgical aspects. So this branch is known as dermatology. And being a homeopath, तो skin diseases में हमारा एक homeopathic view होता है that skin diseases are the outward expression of what is going on inside. They are not simple skin problems जो कि हम external surface पर देख पा रहे हैं, but they are the result of underlying internal disorder. They are the reflection of internal dyscrasia or the disease or disharmony, and which represents that the vital force is diseased. The skin basically is the largest organ, and it serves as a mirror which reflects the condition of various internal vital organs, and they are the dynamic disease that appear on surface of the body, but the cause, they appear externally, but the cause is always within or internal. So disease, basically skin disease that comes from center, from the internal organs to the circumference. So we can say that no disease can be local. They are the outward expression of inward and the spiritual vital force. होम्योपैथिक ट्रीटमेंट की जब हम बात करते हैं तो स्किन डिजीजेस में बेसिकली द पेशेंट विद स्किन डिजीजेस इज टू बी ट्रीटेड एज अ होल. हम सिर्फ स्किन डिजीज और इन होम्योपैथी वी डू नॉट ट्रीट द डिजीज एनी डिजीज विद द नेम ऑफ डिजीज लाइक एक्ने है, एक्जिमा है, सोरियासिस है, तो हम उसके अकॉर्डिंग हमारा ट्रीटमेंट नहीं होता, बल्कि हम पेशेंट को एज अ होल लेकर ही चलते हैं. एंड नॉट ओनली फॉर द स्किन लेजन्स या पार्ट्स या ऑर्गन्स और सिस्टम्स के अकॉर्डिंग हम ट्रीट नहीं करते. And the constitutional treatment or the anti-miasmatic treatment, they are the only way for radical cure. और यहाँ पर जब एक एक्सटर्नल डिजीज है वहां पर कॉज इंटरनल है, तो वी ट्रीट पेशेंट एज अ होल और जो कॉज है उसको भी साथ में लेकर वी ट्राई टू ट्रीट द पेशेंट. एंड any attempt to alter this expression artificially या सिर्फ एक्सटर्नल ट्रीटमेंट देकर हम अगर इन केसेस में काम करते हैं तो it is an act of dishonesty. Then in homeopathic case taking, basically being a homeopath, we do in-depth study of a case to individualize. The purpose of the such a lengthy case taking is to individualize a case. Means we have to differentiate every skin case, every single skin case from others of the same group. Like eczema के ही अगर हमारे पास 4 पेशेंट हैं तो हम उन 4 पेशेंट्स को भी डिफरेंशिएट करने की कोशिश करते हैं बाय सम ऑफ द एक्सक्लूसिव फीचर्स. वो फीचर्स जो कि पेशेंट को इंडिविजुअलाइज कर सकें. वो फीचर्स आपको फिजिकल्स में भी मिल सकते हैं, उस पेशेंट की एपेटाइट, थर्स्ट, डिजायर्स, अवर्जन्स, पर्सपायरेशन, थर्मल रिएक्शन वहां भी छुपे हो सकते हैं. और मेंटल जनरल्स में भी कि पेशेंट हाउ ही इज, उसकी अंडरस्टैंडिंग कैसी है, उसकी विल कैसी है, उसकी मेमोरी कैसी है, हाउ ही रिएक्ट्स टू सर्टेन सिचुएशन. सो ये फीचर्स जो इंडिविजुअलाइजिंग फीचर्स होते हैं जो कि एक पेशेंट को दूसरे पेशेंट से डिफर करते हैं और मेडिसिन सिलेक्शन में हेल्प करते हैं, उन ये जो सिम्टम्स हैं वो कहीं भी छुपे हो सकते हैं, फिजिकल्स में भी, मेंटल्स में भी. एंड बीइंग अ होम्योपैथ वी हैव टू इन्वेस्टिगेट द केस प्रॉपरली और वी हैव टू डिग आउट दोज एक्सक्लूसिव और इंडिविजुअलाइजिंग फीचर्स फ्रॉम द केस टू prescribe a simillimum, to find out the perfect simillimum. That is why we say that case taking, homeopathic case taking is not a mechanical process, but it is an art and skill. Then no real cure can take place without a strict particular treatment of each case of the disease. So we must individualize a case to reach out to our simillimum that is written in aphorism 82. In aphorism 153, Dr. Hahnemann wrote that in search of a homeopathic specific remedy, that means that a remedy that is specifically made or suited to the particular patient, the more striking, singular, uncommon, peculiar, characteristic signs and symptoms of the case of disease are chiefly and most solely to be kept in view. So we have to find the most striking, singular, uncommon, peculiar, characteristic symptoms, skin symptoms or the general symptoms of the case of disease जो कि हमारे guide होंगे to find out the simillimum. और इस तरह के जो भी केस क्योरेबल होगा उस केस में आपको इस तरह के सिम्टम्स जरूर मिलेंगे. अदरवाइज जो जितने भी जनरल या अनडिफाइंड सिम्टम्स जो होते हैं वो हमें दे आर इम्पॉर्टेंट टू मेक द डायग्नोसिस. द एम ऑफ केस टेकिंग इज टू मेक द डायग्नोसिस बट ऑल्सो द थेरेपेटिक डायग्नोसिस. तो इंडिविजुअलाइजिंग फीचर्स यूजफुल होते हैं टू मेक थेरेपेटिक डायग्नोसिस. एंड जो आपके कॉमन सिम्टम्स होते हैं, जो अनडिफाइंड जनरल सिम्टम्स होते हैं, दैट इज रिक्वायर्ड फॉर पैथोलॉजिकल डायग्नोसिस, जो कि कॉमन सिम्टम्स हैं जो आपको हर एक केस में मिलेंगे. बट जो uncommon, peculiar, characteristic symptoms होंगे, that is useful for therapeutic diagnosis, means to find out the simillimum of the case. और इस तरह के क्योरेबल केसेस में आपको जरूर इस तरह के सिम्टम्स मिलेंगे, बस हमें बहुत ध्यान से वो सिम्टम्स अपने केस में से, अपने पेशेंट से निकालने होंगे. Then the selection of simillimum is basically depends upon the totality of the symptoms. Totality क्या है? It's a full broad term and it consider everything that is essential to know about the disease and the patient. It is everything that is visible, that we perceive through our senses, through our observation, by touching the patient, by seeing the patient. That is everything that enables us to understand the phenomena of disease, that is required to individualize the disease and to individualize or differentiate between the different remedies. So we can say that it is the entire representation of the disease or the drug. In aphorism 7, Dr. Henneman explained this totality of symptoms as now as in a disease from which no manifest exciting or maintaining cause, that is causa occasionalis, has to be removed. We can perceive nothing but the morbid symptoms, be the symptoms alone by which the disease demands and points to the remedy suited to relieve it. And moreover, the totality of these its symptoms of this outwardly reflected picture of the internal essence of the disease, that is the affection of the vital force, must be principle or the sole means whereby the disease can be made known, what remedy it requires, the only thing that can determine the choice of the most appropriate remedy, and thus, in a word, the totality of symptoms must be the principle. So this totality, after removing the exciting and maintaining cause in any case, that picture we perceive is known as the totality, which is solely the thing that is required to find out the most appropriate remedy. Totality कैसे बनाएंगे? So in a skin case, हमारे पास basically what should be known, हमें जो सिम्टम्स, जो भी स्किन सिम्टम्स हैं उसके लोकेशन पता होना चाहिए, सेंसेशन पता होना चाहिए, हमें उसकी मोडालिटीज फाइंड आउट करनी है एंड द कंकॉमिटेंट सिम्टम्स. उसके साथ साथ हमें ये भी देखना है कि फिजिकल जनरल्स क्या है पेशेंट के, मेंटल जनरल्स क्या है पेशेंट के, एंड उसके अकॉर्डिंग एक टोटलिटी फॉर्म करनी है, जिसके बाद हम पेशेंट जो भी रेमेडी होगी वहां तक पहुंचेंगे. लोकेशन इज इम्पॉर्टेंट, लाइक हम आर्निका अगर देते हैं तो सिमेट्रिकल जो है रिप्रेजेंटेशन मिलती है हमें, तो वी कैन थिंक ऑफ आर्निका. फिजिकल जनरल्स में थर्स्ट इंक्रीज है लार्ज क्वांटिटी के लिए, वी कैन थिंक ऑफ ब्रायनिया. आर्सनिक की थर्स्ट है, स्मॉल सिप्स ऑफ वाटर ले रहा है, तो वी कैन थिंक ऑफ विद बर्निंग है, सेंसेशन इज बर्निंग है, तो वी कैन थिंक ऑफ आर्सनिक. इस तरह से हम मेडिसिन को डिफ्रेंशिएट कर सकते हैं, बट केस टेकिंग में हर एक पॉइंट को जानना, हर एक द इरप्शंस की लोकेशन क्या है, दैट कैन डिफरेंशिएट योर रेमेडीज. उसकी सेंसेशन बर्निंग है, इचिंग के साथ मोडालिटी, इफ इट इज रिलीव्ड बाय कोल्ड वाटर तो रेमेडी डिफर कर जाएगी, इफ इट इज रिलीव्ड बाय वार्म वाटर रेमेडी डिफर कर जाएगी, इफ इट इज रिलीव्ड बाय रबिंग, so if the scratching leads to burning. So all these symptoms is to be known from the patient to find out the chief remedy or the most similar remedy. Then cure जो होगा वो भी इंटरनल कॉज से विद इन टू आउटवर्ड ही होगा. तो मेडिसिन हम इंटरनल ही देंगे जो कि इफेक्ट करेगी जैसे जैसे कॉज जो है खत्म होता जाएगा, या इंटरनल जो डिस्क्रेसिया था वो नॉर्मलाइज होता जाएगा, तो जो स्किन इरप्शंस जो एक्सटर्नली अपीयर कर रहे हैं वो भी ठीक होते जाएंगे. सो क्योर इज ऑलवेज विद इन टू आउटवर्ड. देन डॉक्टर हेनीमैन ने एक्सटर्नल एप्लीकेशंस के बारे में क्या किया. इट मे बी सीन एज अ क्योर प्रोसेस of a local disease could be accelerated with correctly chosen homeopathic remedy internally as well as externally selected on the basis of totality of symptoms. हमें लगता है कि अगर हम इंटरनल भी मेडिसिन दे रहे हैं या एक्सटर्नल दे रहे हैं तो क्योर जो होगा वो एक्सेलरेट हो जाएगा, हमें जल्दी हम क्योर अचीव कर पाएंगे. It might possible produce a more rapid improvement. But in 194, Dr. Hahnemann क्या कहते हैं कि it is neither beneficial in acute disease of rapid growth nor in those of long standing to use a remedy externally as a local application to the disease part, even if the medicines were specific and curative in that form. So we should not use the remedy externally, चाहे वो acute disease हो, चाहे वो chronic disease हो, because that is an entirely objectionable treatment. इससे क्या होगा, जब हम अगर मेडिसिन एक्सटर्नली भी अप्लाई कर रहे हैं तो दे कैन बी चांसेस ऑफ प्री मेच्योर डिसअपियरेंस ऑफ द लोकल सिम्टम्स. तो एक्सटर्नली वो सिम्टम्स अगर डिसअपियर हो जाते हैं तो वी डू नॉट गेट टू नो कि इंटरनली डिजीज अभी है या नहीं. देन दे कैन बी रेट्रोगेट चेंज कि एक्सटर्नली वो सिम्टम्स डिसअपियर हो रहे हैं बट इंटरनल डिस्क्रेसिया जो है वो इंक्रीज होता जाएगा. एंड आपकी जो असेसमेंट है कि डिजीज खत्म हो गई, नहीं हो गई, क्योर हो गया या नहीं हुआ, तो वो आप असेसमेंट जो है इट कैन बी डिफिकल्ट टू असेस. बट इन सम केसेस देयर आर फ्यू एक्सेप्शंस जहां पर हम एक्सटर्नल एप्लीकेशन कर सकते हैं. दैट इज ओनली इन द केसेस वेयर एडमिनिस्ट्रेशन ऑफ द मेडिसिन इज डिफिकल्ट बाय माउथ, या फिर उन केसेस में मोर और लेस अगर हम ऑल्फेक्शन या इनहेलेशन प्रोसेस यूज करते हैं तो दैट कैन बी बेनिफिशियल और मोर एफिकेशियस. Then I want to share some of the cases. सेकेंड थिंग मैं ये बताना चाहूंगी इससे पहले, केसेस शेयर करने से पहले, कि हमारी जो अप्रोच है स्किन केसेस में या किसी भी तरह के केसेस में, इट शुड बी फ्लेक्सिबल. बहुत तरीके हैं एक सिमिलिमम तक पहुंचने के, जैसे कि कुछ केसेस में अकॉर्डिंग टू द केस या अकॉर्डिंग टू द सिम्टम्स अवेलेबल वी हैव टू अप्रोच इन ईच एंड एवरी केस. हमें की नोट्स मिल रहे हैं तो वी कैन डू की नोट प्रिस्क्राइबिंग जिसमें हमें बहुत अच्छे रिजल्ट्स मिलते हैं. देन देयर इज वन इज टोटलिटी ऑफ द सिम्टम्स, जो डॉक्टर हैनीमैन हमें सिखा कर गए हैं कि टोटलिटी बनाइए एंड उनके बेसिस पर आप अप्रोच करिए. देन थ्रू द एसेंस, थ्रू द लाइफ सिचुएशंस में हमें कुछ ऐसे क्लूज मिल जाते हैं जिस पर हमारी प्रिस्क्राइबिंग जो होती है. समटाइम्स वी डू प्रिस्क्राइब ऑन कॉजेज कि एक्साइटिंग कॉज क्या रहा, उसके बेसिस पर हम प्रिस्क्राइब करते हैं. समटाइम्स मियास्मेटिक प्रिस्क्राइबिंग होती है. देन इंडिस्पोजिशन इज टू बी टैकल्ड आउट. मैनेजमेंट केस का करना बहुत जरूरी है. समटाइम्स हमारे जो केसेस होते हैं वहां पर सिर्फ मैनेजमेंट की जरूरत होती है एंड देयर इज नो नीड टू प्रिस्क्राइब एनी रेमेडीज. सो वी हैव टू सी, हमें हर एक केस को एक नए केस की तरह देखना चाहिए और उसी की तरह जो हमें मिल रहा है या जितने इंफॉर्मेशन हमें पेशेंट से मिल रही है उसके अकॉर्डिंग वी हैव टू अप्रोच टू आवर केसेस. Now this is one case. This is a case of leukoderma. This patient leukoderma with tinea infection. A male aged 28 years came to me for his skin problems, which with much itching, and as you can see in the picture, there are hypopigmented spots. These tinea eruptions leaving hypopigmented spots afterwards, and the location is starting from the lips then appear at the upper limbs. Sensation, there is very much intense itching and burning sensation. Aggravation is at night, and there's when the patient, there is perspiration, the itching aggravates in damp. Amelioration is by scratching. The patient appetite was average and thirst was increased. There's desire for non-veg. Tongue was coated white with red edges. Sweat was increased, which aggravates his skin condition. And thermal reaction, the patient was hot in thermals. At first, I prescribed Rustox 30 in this case due to the aggravation in the damp region and because of the skin the appearance of the skin, aggravation night, perspiration, aggravation and all. So I prescribed Rustox 30 BD for a week, and after a week, this is the condition. There are hypopigmentation or the eruptions over the lips and the upper limbs. You can see in the pictures. After 1 week in the follow-up, there was improvement, but eruptions were almost cleared up. The tinea eruptions were almost cleared up, but the hypopigmentation, pigmented spots still present. On further inquiry, it was found that in the family history, the patient's grandmother was asthmatic. She had some breathing difficulty. And in the mentals, the patient was very afraid of dogs. So in the second prescription, I prescribed Basilinum 200 as an intercurrent remedy, followed by placebo. And after that, in the 3 months, I haven't prescribed anything except SL. And you can see the result in this case. All the leukodermal eruptions are disappeared. This is the condition. This was the first, after 1 week, this was the thing. And after Basilinum 200, slowly after 3 months, this is the improvement in the case. Remedy analysis, because of the fear of dogs and the family history, that is the presence of that breathing difficulty or asthmatic condition, I thought of Basilinum. Ringworm affections are more in Basilinum, and there is venous plethora around the eruptions. The sphere of action of Basilinum is base of lungs, and the mentals, there is presence of irritability and the fear of dogs, and Basilinum patient is usually hot. On these basis of these symptoms, I selected Basilinum 200, and here you can see the results. This is my next case is of wart. A tall middle-aged male patient came to me with a complaint of a wart located over his left thigh. That is very large and painful. Associated complaint, the patient, जो patient था वो बहुत पुराने patient है मेरे, and mostly वो occasionally ऐसे बीच बीच में visit करते हैं, and he always complained of the aching pains in the extremities, which is persistent since long, which aggravates while rest and amelioration by motion. ट्रीटमेंट बेसिकली वो क्या करते हैं कि पेन किलर्स ऑन एंड ऑफ लेते रहते हैं. कभी मन किया तो मेरे पास आ गए कि मुझे दर्द है, आप दे दीजिए दवाइयाँ, देन फिर डिसकंटिन्यू हो जाती है, कुछ टाइम रिलीफ आता है, तो बीच में मैंने उन्हें रस्टॉक्स दिया, सो लिटिल रिलीफ वाज देयर. बट ट्रीटमेंट जो है वो बहुत ऑन एंड ऑफ कंटिन्यू करते हैं. कभी पेन किलर ले लेते हैं, कभी होम्योपैथिक ट्रीटमेंट ले लेते हैं, तो ऑन एंड ऑफ उनका इस तरह से ट्रीटमेंट चलता रहता है. ये उनकी बड़े टाइम से इस तरह की, जब भी वो मेरे पास आते हैं तो बीच में इस तरह की कंप्लेंट थी. देन अचानक एक दिन आए और ही कंप्लेंट ऑफ दैट वॉट. एडिक्शन वाज ऑफ टोबैको. तंबाकू खाने की उनकी बहुत ज्यादा आदत है. जब भी विजिट करते हैं तो तंबाकू, ऑलवेज ही कीप ऑन च्यूइंग दैट tobacco, and there is aversion of tea in that patient. On repertorizing this case, jo large wart, painful wart on the left thigh, and there's desire of tobacco and aversion to tea, so Thuja was coming up as the highest grade remedy. Analysis for the remedy Thuja was coming up, and it is in, as we all know, that it is an antipsychotic remedy, principally left-sided remedy hai. And in Kent, I have read that there were aching pains that increase so long as he keeps still. He's compelled to keep the bed and then constantly moves and turns. Such symptom would be cured by Rustox when the case is not psychotic. I have given Rustox, जो उन्हें लिटिल रिलीफ भी मिला, बट उनका जो वो पेन था वो नहीं जा रहा था. बट केंट में जब उनके वॉट के लिए हमने रेमेडी दी, तो आई हैव रेड दीज लाइन्स, बट व्हेन द केस इज साइकोटिक, and because of suppressed gonorrhea, meadow or thuja will cure. That is, these lines are written in Kent. So on the basis of this whole history and on the symptomatology, I have prescribed thuja to the patient, and here's the video.
राधे राधे। मेरा नाम घनश्याम है। मेरे जांघों के बीच के अंदर एक मस्सा हुआ था जो मुझे बहुत परेशान कर रहा था। फिर मैंने डॉक्टर श्वेता से दवाई ली। दवाई लेने के 6 या 7 दिन बाद वो अपने आप ही टूट के गिर गया। अब मुझे आराम है, किसी प्रकार की कोई दिक्कत नहीं है।
सो विद थूजा उनके जो पेन्स थे वो भी बहुत हद तक रिकवर हुए एंड वो 1 हफ्ते में लगभग वो जो वार्ड था वो भी झड़ के गिर गया था। दिस इज द नेक्स्ट केस ऑफ बुलस पेम्फिगॉइड। ये पेशेंट aged 46 years, she came to me with her vesicular type eruptions जो कि उनको 1 साल से परेशान कर रहा था, and it was diagnosed as bullous pemphigoid by a skin specialist. Allopathic medicine से भी उनको कोई आराम नहीं आया. Then she visited me, and in the past history she was diabetic since many years, and she was on allopathic treatment which is uncontrolled. So she's not controlling, she has no control over her blood sugar levels. She was hypertensive also, and she was on allopathic treatment, but the BP is controlled. In physical generals, I got that appetite, it was average, 3 meals, no complaints before or after eating. Thirst was moderate. There was desire for sweet things and cold things. Stool, she's constipated, has to strain to pass stool, sometimes pain during and after. Sleep was sound and refreshing. Perspiration was scanty. It is more over face, non-offensive and non-staining. Mentals में she was very carefree and careless आप कह सकते हो, because शुगर 250 और 250 से क्रॉस भी हो जाती थी, बट उनको किसी तरह का कोई इस चीज से डर नहीं था. मेडिसिन टाइम से लेना, खाने पीने का कोई परहेज करना, ऐसा कुछ भी उनके साथ नहीं था. Then remedy indications were tendency to develop the skin phase of internal disorders. Remedy for climacteric stage, she was 46. Just a second. Repertory chart was missing. So basically, on the basis of the symptoms, like she is obese, she was a chili patient, she desires sweets and cold things, she was constipated, and the remedy, I have prescribed graphitis in that case, single dose in water dose, like 100 ml pani mein, just 1 drop of graphitis 30 I have given, and it is followed by Seclec 30 for the next 15 days. The prescription was basically based on the remedy for graphitis is the remedy for climacteric stage. What pulsatilla is for puberty, this remedy is for climacteric. The patient was heavily built, she's stout, she's obese, constipation is there, she's costive, chilly patient, and desires sweets. On the basis of this totality, I have prescribed graphitis, and you can listen to the patient now.
मेरा नाम व्यावती शर्मा है। मैं दिल्ली पालम में रहती हूँ और मेरे 2017 में स्किन की प्रॉब्लम हुई थी। पूरे शरीर पे पानी पानी से दाने से हो गए थे। मैं कई डॉक्टर को दिखाई, एक डॉक्टर चला वहाँ दिखाई, उसने बोला कि दवाई दी, मेरा ब्लड टेस्ट के लिए बोला, ब्लड टेस्ट की रिपोर्ट आई और उसने बोला कि ये मेरे बस की बात नहीं है, आप एम्स में जाओ। आप 3 डॉक्टर एक साथ लेके आपका वो करेंगे ट्रीटमेंट। फिर मैं यहाँ वहाँ गई, पानीपत में डॉक्टर है, वहाँ गई, उन्होंने भी मुझे दवाई दी, लेकिन दवाई जैसे पहले बोला कि आपके बीपी शुगर है, तो आप मैं ये दवाई लेने से पहले आप अपने डॉक्टर से बात करना, उसके बाद में ये दवाई लेना। फिर मैं दोबारा इसी डॉक्टर के गई जब कैलाश में, तो उसने बोला कि नहीं, आपका इलाज मेरे से नहीं हो सकता, आप तो एम्स में ही जाना पड़ेगा आपको। तो फिर मैं बहुत घबरा गई। फिर मेरे को किसी ने बताया कि होम्योपैथिक डॉक्टर है ये श्वेता। फिर मैंने इनको अपनी रिपोर्ट भेजी, इनसे बातचीत करी, इन्होंने रिपोर्ट देकर बोला होम्योपैथी, इनसे मैंने ट्रीटमेंट लिया और इनके ट्रीटमेंट से मेरा बिल्कुल 15 दिन में ही इनकी होम्योपैथिक दवाई से मेरे को फायदा और कोई नया दाना भी नहीं हुआ। मेरे को बिल्कुल फायदा हो गया, अब मैं बिल्कुल ठीक हूँ, अब मेरे कोई दाना आया नहीं है, कई निशान भी जो निशान हो गए थे पूरे शरीर पर, निशान भी मिट गए हैं।
सो दिस इज द ब्यूटी ऑफ होम्योपैथी की सिंगल डोज हमने ग्रेफाइटिस 30 के दिया, जहां वो पेशेंट इतने एलोपैथ्स या दूसरे डॉक्टर्स के पास होकर आई जहां पर उन्हें किसी तरह का रिलीफ नहीं मिला, वहां पे हमारी होम्योपैथिक मेडिसिन जो कि सिंगल डोज हम दे रहे हैं उससे भी इस तरह के रिजल्ट्स हमें 10-15 दिन में मिल रहे हैं। और उसके बाद आज तक भी जो पेशेंट मेरे पास आती हैं या बात होती है तो अभी तक उन्हें दोबारा वो कंप्लेंट रिकर भी नहीं हुई। Now this is the case. This is the case of papilloma on a patient who is a housewife aged 30 years, about 5 feet 5 inches tall, weighing 88 kg. She was obese, presented with an outgrowth on her left breast. तो इस तरह की outgrowth को लेकर patient मेरे पास visit करती है, and on physical examination, you can see that the location was left breast areola, and it's a wart-like growth, fluid-filled, pea-sized, hanging with a stalk, which means it is pedunculated, and the sensation, the wart is very painful. On analyzing the case, on repertorizing the case, I have taken this, the wart is large, pedunculated, painful, and soft. You can see 2 remedies are coming in all the rubrics, that is nitric acid and thuja. मैं शेयर करना चाहूंगी कि ये जो केस था, आई वॉज इन अ चैरिटेबल, वहाँ का केस है, एंड द पेशेंट वॉज वेरी मच एंशियस अबाउट हर हेल्थ. शी वॉज कीप कमिंग टू मी बिफोर दिस वार्ड. She was keep coming to me to check for the lump in breast, जो कि नहीं था. For the past 2 years, she was keep coming to me, क्योंकि उनकी किसी फ्रेंड को ब्रेस्ट कैंसर डायग्नोस हुआ था, तो उनको उस टाइम से एक एंजाइटी होने लगी कि कहीं उनको ये फीलिंग आने लगी कि मेरी ब्रेस्ट में लंप है. सो शी वॉज कीप कमिंग टू मी कि मैम प्लीज चेक कर लीजिए. हर कुछ दिन बाद शी कीप कमिंग टू मी कि आप चेक कर लीजिए, कुछ कोई लंप तो नहीं है, कोई गांठ तो नहीं है मेरी ब्रेस्ट में, मुझे पेन फील होता है एंड ऑल. एंड मैं चेक करती थी तो देयर वाज नो लंप और नथिंग इन हर ब्रेस्ट. एंड कॉइंसिडेंटली आप कहें कि वो हमेशा लेफ्ट ब्रेस्ट में ही कंप्लेंट करती थी कि मुझे कुछ फील होता है मैम, आप एक देख लीजिए, कोई लंप तो नहीं है, मुझे कुछ है तो नहीं. यहाँ तक कि शी वेंट फॉर मेमोग्राफी, जो कि नॉर्मल ही आई, बट उनकी जो एंजाइटी थी वो इतनी ज्यादा थी, एंड उसके मेमोग्राफी कराने के बाद भी, उसके नॉर्मल आने के बाद भी, वो हमेशा कुछ महीनों बाद या कुछ टाइम बाद हमेशा आती रहती थी कि मेरी ब्रेस्ट आप चेक कर लीजिए, एग्जामिन कर लीजिए कि कहीं कोई जो लंप है वो प्रेजेंट तो नहीं है, कोई दिक्कत तो नहीं है, जो कि इट वाज एब्सोल्युटली नॉर्मल. एंड कुछ टाइम बाद शी केम विद दिस वॉट लाइक ग्रोथ in her left breast. So I also keep one more rubric, that is anxiety health about, and is rubric mein there was only single remedy that was coming from thuja and nitric acid. Nitric acid is coming, so I prescribe acid nitric 30 to her. On repertorizing the case, warts pedunculated, large, painful, and it was soft. And anxiety health about, nitric acid was coming as a top grade remedy, so I prescribed nitric acid 30 to that patient, and you can see the progress. Day 1 the wart is like this, and on day 3 it got shrinked, day 7, and on day 15 it was dropped down and it disappeared with the dose of nitric acid 30. This is a case of ringworm, tinea. A male patient aged 48 years came with the itching eruption since 3 weeks. Location was upper chest, right-sided, and there was much itching and burning after scratching. Aggravation was after arm bracing. Appetite was normal, desire for sweet, thirst was decreased 1 to 2 glasses per day, perspiration was more over palms, tongue was clean, moist, and thermals the patient is hot. On repertorizing the case, sulfur is coming as a top grade remedy. So I prescribed because of the desire of sweets, because the patient was hot. So among all the other remedies, Merck and sepia, these arsenic, these are chili remedies. Arsenic has a lot of anxiety, and because of all these, I went with sulfur only, and I gave sulfur 30 to him. And you can see the result. The first visit was in August 2020, and in September 2020, all the eruptions were disappeared with the dose of sulfur. This is another case of atopic dermatitis, and it is a case of 2 months old baby girl, जो कि आप स्किन की कंडीशन देख सकते हैं किस तरह की है. So on seeing this condition of the patient, the symptoms, you can see that the symptoms are moist skin eruptions. There is copious serous exudation. There is thick leather-like crust under which thick and white pus collects here and there. Here you can see they are glued and matted together. The eruptions and the discharge is very offensive, and all these condition is happened after vaccination. So after seeing this condition of the case and the history of vaccination, only one remedy came to my mind, and that is Mesareum. So on this keynote, I prescribed Mesareum 30 to that little girl, and you can see the results. This case came to me on 3rd January, and on 8th January, in a week, you can see the results. All the eruptions are vanished off. There is no eruption. This is one more case of a wart. You can see the appearance and the location. This patient is very obese. There is face on the warts, on the throat. Patient is obese. There is desire for salty food, and the patient is very timid. So the timidity, the obesity, and the location of this thing, the wart, desire for salty food, there is increased perspiration. So I prescribed Calcarea carb 30 to this patient, and these are the result. This is the first visit. You can see on the throat, there is no warts, and on the forehead, there is decrease of the wart. There's one more case of urticaria. A lady aged 39 years complaining of swelling over her lips, recurring since many years. And there is sensation of pricking sensation was there, and always it aggravates in the morning. Associated complaints were cracked skin of the palmar surface of hands, more over the tips of fingers, with much itching and pain. There is chronic pain in the chest, aggravation by cold things, which had an occasional appearance. Appetite was normal. Desire for salty food. Stool was unsatisfactory. There was constipation, hard stool, burning sensation after stool. Urine was frothy, offensive. Occasionally, tongue was white clotted. Sleep disturbed. Thermal reaction, hot patient. And leukorrhea was there, which is profuse, thick, pale yellow in color and acrid. Aggravation while urination. In the mental journals, there is very much irritability. There is weeping tendency. She has lost her husband. So there is very much grief. She had 3 children, which she has to taking care of. She is taking care of 3 children alone, and she is very emotional. So on the basis of this grief and irritability, desire for salt and all, I repertorized the case. Urticaria lips, cracked skin, fingertips, cold air aggravation, desire for salt, constipation, pain, burning stool, aggravation after. Natramute was coming as the top grade remedy, and it is also going covering the mental picture of the patient. So I gave Natramute 200, and there after that dose there is no swelling recurrence since 2-3 years now, and you can listen to the patient.
काफी टाइम से मुंह पे स्वेलिंग आती थी, तो मुझे कई डॉक्टरों को दिखाया मैंने, लेकिन उसको कुछ आराम नहीं पड़ा। तो फिर मैंने डॉक्टर श्वेता को दिखाया और उन्होंने जो भी मुझे दवाइयाँ दी हैं मैंने खाई है, पूरा ट्रीटमेंट जो कहा था उन्होंने, तो उसके ट्रीटमेंट मुझे काफी आराम पड़ा। लेकिन अब 1 साल से मुझे कोई भी स्वेलिंग नहीं आ रही है, मैं बहुत ठीक हूँ।
So the conclusion is the action of homeopathic remedy is not slow at all, and the speedy recovery in patient who adopt it as the first line of treatment. जो patient जितनी जल्दी हमारे पास आएंगे उतनी जल्दी ही वो recovery हो जाएगी, and there is no side effects. So thank you everyone.
थैंक यू मैम, आपका प्रेजेंटेशन बहुत अच्छा था।
Thank you.
और मैं आशा करता हूँ कि सबको बहुत पसंद आया होगा, बहुत कुछ सीखने को मिला होगा। अभी तो हम लोग के पास बहुत समय है
जी,
क्वेश्चन आंसर सेशन इसमें कर सकते हैं, कुछ डिस्कशन भी कर सकते हैं।
डॉक्टर शेषाधरन कुछ कहना चाहते हैं। डॉक्टर शेषाधरन, यू कैन स्पीक सर। Dr. Seshadharan, you can talk, sir.
Yes, for me.
Yeah, you audible.
So, madam, it was very good, Dr. Seva. It was a very good, nice presentation. बहुत बढ़िया था, बहुत अच्छा था, different kinds of cases था, बहुत बढ़िया था। आ जाइए, हमारा इंग्लिश सेक्शन में भी आ जाइए।
जी सर, जरूर आऊंगी सर, आप जब बुलाए सर मैं हाजिर हूँ।
जरूर बुलाएंगे।
थैंक यू।
हमारा सगानी साहब है तो फिर क्या बात है, सगानी
जी
साहब सब कुछ अरेंज कर सकता है, कुछ भी।
हाँ जी सर,
ठीक है, थैंक यू वेरी मच,
थैंक यू सर।
वेरी एनकरेजिंग।
हाँ, बहुत बढ़िया प्रेजेंटेशन है श्वेता जी।
थैंक यू सर।
और आपने सबसे बड़ी बात जो कही कि टोटलिटी और कॉन्सेप्ट होना चाहिए। मैं थोड़ा सा इसमें एक ऐड करना चाहूँगा कि होम्योपैथी में जो हम लोग माइग्रेन की बात करते हैं, सोरा सिफिलिस साइकोसिस, तो सोरा वर्ड का जो ओरिजिन है और डॉक्टर हेनिमैन के दिमाग में सोरा के विषय में जो ध्यान गया, वह उसका जो मन क्या कहते हैं कि सोर्स ऑफ, जैसे कहते हैं ना कि एप्पल में न्यूटन के लिए एप्पल था, तो हेनिमैन के लिए ईच जो था, खुजली जो था, ये ज्यादा इम्पोर्टेंट था। और उन्होंने सोरा जो प्राइमरी माइग्रेन को, मैंने बेसिक माइग्रेन को कहा कि सोरा। ना सोरा को थोड़ा सा इंटरप्रेट हम लोग इस तरह से भी करते हैं, ईच किसको कहते हैं, क्योंकि ईच का मतलब खुजली, खुजली का मतलब होता है कि दैट व्हाट इज गोइंग ऑन द मूविंग कंडीशन। एंड सबसे ज्यादा ईच आपको कहाँ पर होता है? शरीर में नहीं होता है, सबसे ज्यादा ईच माइंड में होता है। एंड माइंड इज द हाउस, ओरिजिन प्लेस फॉर ऑल द ईचेज। हमारे मन में कॉन्ट्रडिक्शंस है, एक दूसरे से द्वेष है, हमारे इमोशंस हैं, जो इमोशनल फ्लक्चुएशंस होता है, ये ईच का जो है सो कारण बनता है, और जिसको कि सब्सिक्वेंटली लेयर बाय लेयर आपके रिफ्लेक्शन। और आपने बड़ा अच्छा बात बताया कि जो सबसे बड़ा ऑर्गन शरीर का है तो स्किन है, तो सबसे बड़ा ऑर्गन भी है और आउटलेट भी है ना। आउटलेट मतलब कहने का मतलब कि बाहर भी जाता है, तो इसमें सबसे बड़ा आउटलेट होने के कारण ये सारे शरीर के अंदर जितने टॉक्सिसिटी, माइंड से टॉक्सिसिटी हुआ, प्लेन पर आया, फिजिकल प्लेन पर टॉक्सिसिटी हुआ, तो वह स्किन के ऊपर में आया, एंड देन इट इज आउटलेट। लेकिन क्या होता है, मन की खुजली को लोग समझता नहीं है, लेकिन शरीर के खुजली को से परेशान हो जाता है और वहां पर ऑइंटमेंट लगा करके उसको जल्दी से जल्दी ठीक करना चाहता है, तो वह इंटरनलाइज हो जाता है, और इंटरनलाइज होकर के वह कॉम्प्लिकेशन क्रिएट होने लगता है और डिफरेंट फॉर्म्स में ये जनरेट करने लगता है। अच्छा लिखा है, फ्रॉम जनरेशन टू जनरेशन। एक में नहीं हुआ, कई एक जनरेशन में जाकर के ये जो है सो ह्यूमन लाइफ में स्टोर हो गया, जमा हो गया, कि एक ऐसा स्थिति बन गया, जबकि हम लोग कभी कभी कहते हैं कि हम लोग जन्म के साथ में सोरा से पैदा लेते हैं, ये जेनेटिक से लेवल पर चला गया। ये एक बहुत लंबा अच्छा कहानी है सोरा के विषय में, और सोरा को यूजुअली हम लोग लिंक करते हैं आपको स्किन प्रॉब्लम के साथ में। लेकिन डॉक्टर हेनिमैन का जो सब्सिक्वेंट थॉट्स है, दैट इज ऑल्सो इम्पॉर्टेंट, ताकि सोरा के बाद में साइकोसिस के बाद में, क्योंकि डेवलपमेंटल स्टेजेज ऑफ द डिजीज इज इम्पॉर्टेंट, है ना। रोग है, आता है, बढ़ता है, फिर बढ़ने के बाद में उसका विकास होता है, फिर डेवलपमेंट होता है, फिर उसका डिटोरेशन होता है। तो सारे स्टेजेस को डिफाइन करने के लिए माइल्ड को उन्होंने 3 स्टेजेस में बांट दिया, कि सोरा, साइकोसिस एंड द सिफिलिस। सोरा, सिफिलिस, साइकोसिस को कुछ नहीं है, इट इज द डिफरेंट 3 स्टेजेस ऑफ द सेम कंडीशन। यहाँ से ऐसे गया, फिर आगे बढ़ा, फिर आगे बढ़ा। कोई भी चीज जन्म लेता है तो उसका विकास होता है, विकास होने के बाद में उसका समाप्त हो जाता है। तो ये है, इसलिए जैसे आपका स्किन डिजीज आप बता रही थी, और आप बहुत सारे केसेस भी आपने बताया, रिंग वर्म से लेकर के वॉट्स तक, तो और सब, फिर नाइट्रिक एसिड का भी केस बताया। नाइट्रिक एसिड के केस में भी आप देखिएगा कि आपको ब्लीडिंग स्टेज है, मैंने एक ब्लीडिंग जा रहा है, खून आ रहा है, इसका मतलब कि नाउ इट इज डेटोरेटिंग, तो ये सिफिलिटिक स्टेज में चला गया। और हम लोग कहते हैं कि नाइट्रिक एसिड बहुत बड़ा सिफिलिटिक मेडिसिन भी है। सल्फर का भी आपने दिखलाया, थूजा का भी आपने जिक्र किया, और इसी तरह से। और मैं बता दूं कि सल्फर, ये जो होम्योपैथिक के मेडिसिन है, तो इतने चमत्कार करते हैं, इसका कोई अंत नहीं है। मैं एक केस आपके साथ में शेयर करना चाहूंगा। शाम का समय था, मैं अपने क्लिनिक में था, एक महिला आई अपनी लड़की के साथ में, और यहाँ से बिहार की नहीं थी, हम लोग के बगल में झारखंड स्टेट है, वहाँ गिरिडीह जगह है, वहाँ से वो आई थी, और ट्रेन से आई थी। ट्रेन से हम लोग पता करके, पता नहीं किसी ने बताया कि डॉक्टर साहनी के पास नहीं जाइए। मैं जब उस लड़की को देखा तो कोई कष्ट नहीं था, मुझे लगा कोई कष्ट नहीं है, क्यों आई है यहाँ पर, तो बोला कि, लेकिन फिर जब हम लोग बैठने तो देखे उसके शरीर, चेहरे पर कई छोटे छोटे वॉट्स थे, एंड पेशेंट बड़ा इंडिफरेंट था, उससे कोई मतलब नहीं था। लड़की की उम्र शादी के लायक थी, और माँ जो है तो लेकर के आई थी। माँ चाह रही थी कि ये जल्दी से जल्दी ठीक हो जाए, जिससे कि हम इसको लड़के वाले को दिखला दें और इसकी शादी हो जाए। और एक शेड्यूल हो गया था किसी लड़के का देखने का, जो अपॉइंटमेंट भी हो चुका था, तो चाह रही थी कि इसके पहले कैसे खत्म हो जाए। तो उन्होंने मुझे यह बात को रखा कि सर आप ऐसा कर दीजिए कि एक दिन में इसका खत्म हो जाए। मैं कहा कि आप क्या हमको जादूगर समझ के आई है क्या? मैंने उनसे ये सवाल किया कि जादूगर तो मैं नहीं हूँ, मैं तो प्रयास करूंगा, और इलाज करने में समय तो लगता ही है, तो मैंने कोई दिलासा नहीं दिया। मैं बोला कि मैं इलाज कर सकता हूँ, देख सकता हूँ, लेकिन पता नहीं उसके अंदर में इतना फेथ था। और मेरे सिलेक्शन में, उसके जो देखने के बाद में मेरे सिलेक्शन में सल्फर आया, और सल्फर का 0/1 पोटेंशियल देकर के मैंने उनको विदा कर दिया। जब पटना, मेरे घर से स्टेशन की दूरी करीब करीब 2 या 3 किलोमीटर होगा, जब वहां से पहुंचती है तो मुझे फोन की, थोड़ा सा उसके शरीर, आवाज में थोड़ा सा एक्साइटमेंट था, ये था, मैं समझ लगा क्या हो गया इसको। वहां पर पहुंच करके कहा कि डॉक्टर साहब देखिए, इसके चेहरे से थोड़ा थोड़ा खून निकल रहा है, और वो गिरता चला जा रहा है। और जानते हैं, घर पहुंचते पहुंचते तक वो सारा वॉट्स जो है उसके गिर गए। तो इतना माने क्विक एक्शन, विदिन 24 आवर्स एक्शन, ये देखने के लिए हम बहुत बड़ा हमको लगा। उस लड़की की शादी हो गई। शादी होने के बाद में उसके हस्बैंड के साथ में आई, और उन्होंने बताया कि हमको पहचाने नहीं शादी के बाद में। लेकिन देखिए कितना ये चेंज हो सकता है आपको होम्योपैथी का। लेकिन योर ऑब्जर्वेशन इज इम्पोर्टेंट। आपने कितनी अच्छी बात करी, ऑब्जर्वेशंस का बात किया, ये ऑब्जर्वेशंस बहुत इंपॉर्टेंट है। और ये चीज को आप ये मत देखिए कि आपको क्या है, मैंने वर्ड्स है कि नहीं, ये सब मैं तो उस पर ध्यान देता हूँ। अब ऑब्जर्वेशंस है, पेशेंट का माइंड है, पेशेंट का बॉडी है, उसको देखिए बहुत ज्यादा। आपने भी बहुत अच्छा जिक्र बताया है कि आपने, ठीक है, फिजिकल जो प्रेजेंटेशन है वो तो है ही, लेकिन उसके साथ साथ में आपका ये चेंजेस भी होता है। एक केस और ब्लीडिंग का मैं थोड़ा बता करके आपको बताऊंगा कि एक बहुत यंग लड़का, ही वाज नॉट, और उसके स्काल्प पर छोटे से वॉट्स थे और पेडिकुलेटेड, आप जैसा पेडिकुलेटेड वॉट्स के जिक्र कर रही थी, वो था। मैंने सिम्टम्स लिया, बहुत सेंसिटिव, बहुत इरिटेबल और विंडिक्टिव नेचर का बच्चा लड़का था। उसके पेरेंट्स उसको लेकर के आए हुए थे। मेरे ये ओपीडी में है, ओपीडी संडे का ओपीडी होता है हम लोग का एक वहाँ पर, तो उसमें मैं बैठा हुआ था, तो उसमें लेकर के आया। मैंने देखा और मैंने सारे लक्षण लेने के बाद में मैंने नाइट्रिक एसिड देने के बाद में एक डॉक्टर्स ने बताया, अरे इससे क्या होगा छोटा सा गोली से। किसी ने उसको कहा कि छोटा सा गोली से क्या होगा। ये बाद में मुझे पता चला कि किसी डॉक्टर ने उसने कहा ऐसे थोड़ी होता है, इसको कटवा लो, इसको मैं सर्जरी करवा लो। लेकिन थोड़ा सा लोग डरे। 2 दिन के बाद में उसके सर से ब्लीडिंग शुरू हो गया। वो लोग घबराए हुए मेरे को फोन किया कि सर ऐसा हो गया। मैं बोला कि कोई बात नहीं, आपका वाट्स गिर गया। और उसके बाद से जो खत्म हुआ वो फिर वाट्स दोबारा नहीं आया। तो ऐसा होम्योपैथी में बहुत ही रोज रोज एक चमत्कार होता रहता है। हमारे सभी साथी, मैं नहीं कहता हूँ कि मैं ही करता हूँ, आप भी कर रही हैं, हमारे और भी साथी भी कर रहे हैं। लेकिन सबसे बड़ा समस्या क्या होता है, स्किन में पेशेंट जो है इतने परेशान रहते हैं कि वो और कभी कभी तो मैं कहता हूँ कि मोस्ट डिफिकल्ट थिंग्स टू ट्रीट द स्किन डिजीज। लोग कहते हैं कि होम्योपैथी में इसका इलाज है, लेकिन सबसे बड़ा बात यह है कि इलाज तो है, लेकिन सबसे डिफिकल्ट, सबसे कठिन काम है स्किन का डिजीज, क्योंकि पेशेंट का माइंड का जो इससे एसोसिएटेड है वो इम्पेशेंस, बहुत बड़ा इम्पेशेंस बीमारी है हम लोग के समाज में। हम लोग चाहते हैं सब कुछ हो जाए तुरंत, कुछ करना नहीं पड़े और कुछ काम हो जाए। ये हम लोग का जो लाइफ स्टाइल है इस तरह से बढ़ता चला जा रहा है, और आपको स्किन प्रॉब्लम्स जो है तो एक परमानेंट पार्ट ऑफ द लाइफ बनता चला जा रहा है। इसलिए हमको लाइफ स्टाइल पर भी ट्रेनिंग देनी चाहिए। रोगी आते हैं तो मैं उनको साधना करने की बात करता हूँ, मैं उनको मेडिटेशन की बात करता हूँ, मैं उन्हें म्यूजिक सुनने की बात करता हूँ। ये सारी बातों को मैं, हमारे साथ में बहुत ही पुराने हमारे बहुत अनुभवी डॉक्टर हैं, डॉक्टर कल्याण स्वरूप, और कल्याण स्वरूप जी को भी बहुत अच्छा अनुभव है, थोड़ा सा हम लोग उनकी बात भी सुनना चाहेंगे।
जरूर सर।
हेलो सर, आवाज आ रही है?
हाँ बिल्कुल आ रही है सर।
तो सर, जिस समय मैं कलकत्ता में प्रैक्टिस कर रहा था तो एक गुजराती लेडीज मेरे पास आई, उसका नाम था ज्योति भोरा। वो अपने बच्चे के मेडिसिन लेने के लिए मेरे पास आई थी। तब जब वो हाथ बढ़ाई मेडिसिन लेने के लिए तो उसके डोर्सम ऑफ हैंड पर देखे एक वाट्स था। तो जो नाइट्रिक एसिड की चर्चा चल रही उसी पर मैं बता रहा हूँ कि वो हमने उसका प्रिस्क्रिप्शन किया अकॉर्डिंग टू सिम्टोमेटिकली देख करके नाइट्रिक एसिड 200 उसको 4 डोज हमने दिया। 4 डोज देने के बाद में वो डिस्टेंस हमारे क्लिनिक से उसका डिस्टेंस होगा करीब 10 किलोमीटर। वो देखे कि नेक्स्ट डे मेरे पास आ रही है, तो नेक्स्ट डे आ रही तो हमको ये नर्वस हुआ कि एसिड ग्रुप का मेडिसिन है, निश्चित है कहीं ना कुछ कंप्लेन बढ़ाया होगा तभी वो मेरे पास आ रही है। हमको ये लगा क्योंकि उसको तो बुलाया है 15 दिन के बाद, वो कल होकर के क्यों आ रही है। खैर वो आई और ज्यों ही उसने हाथ बढ़ाई मेरे तरफ, हमने देखा कि वो लेयर ज्यों के त्यों समतल है, किसी तरह का कोई खरोच नहीं है, और वो वाट्स दो करीब करीब कहाँ से चला गया और कैसे गॉड ने उसको ऊपर से बनाया था और उसी में डिजोल्व कर दिया। ये देख करके हमको लगा कि सचमुच में होम्योपैथी के अंदर कुछ चमत्कार तो होती है, बशर्ते कि सिम्टम्स भी टैली करे, पेशेंट भी ससेप्टिबिलिटी हो, पोटेंसी भी सही मिल जाए और आपका दवा भी सही मिलना चाहिए, और सिलेक्शन अगर मिनिमम हो गया तो निश्चित है कि होम्योपैथी की एक्शन जो होती है बहुत ही अच्छी एक्शन होती है, और एक केस में नहीं कई केस में ही देखा जाता है सर। इसलिए हम लोग को सिमिलिमम के तरफ तो जाना पड़ेगा, सिमिलर के साथ साथ सिमिलिमम के तरफ जाना पड़ेगा। सिमिलर तो करेगा ही, सिमिलिमम में अगर चले गए, और सिमिलिमम करने के लिए सर एक चीज और जानकारी है, सिमिलिमम नॉट ओनली इन द सिम्टम्स, सिमिलिमम होना चाहिए पोटेंसी के अंदर भी, सिमिलिमम होना चाहिए डोज के अंदर भी, सिमिलिमम होना चाहिए मेडिसिन माइजम के अंदर भी। अगर चारों तरफ से सिमिलिमम अगर हम ले लेते हैं, माइजम से भी, पोटेंसी से भी और मेडिसिन से भी, तो हमारा मेडिसिन की क्रिया जो होती है, होम्योपैथिक मेडिसिन की क्रिया बहुत ही अच्छी होती है। इसको कोई मान नहीं सकता, उसमें काट नहीं सकता सर, और हम हर एक केस में सक्सेस कर सकते हैं। मगर एक चीज बात रह गया, लोग क्रोनिक केस में कहते हैं कि बहुत टाइम लगता है, बहुत टाइम नहीं लगता है। मैंने एक जगह जवाब दिया था कि नेचर है, हर डिजीज का एक आने का तरीका होता है और जाने का तरीका होता है। जो डिजीज जितने वक्त में आ सकता है और जाने में भी वक्त उसको जरूर लगेगा। अगर एक कॉलरा का केस अगर हम देख रहे हैं तो कॉलरा के केस में हम वक्त नहीं लेंगे, हम 2-3 घंटे के अंदर उसको रिलीफ देंगे। एक हेडेक का केस अगर आज हेडेक है तो हम 2-3 घंटे में उसको आराम दे सकते हैं। मगर एक कंटिन्यूअस 1 साल से अगर हेडेक है तो उसको कहेगा 1 घंटे में आराम करने के लिए, तो हम 1 घंटे में आराम नहीं कर सकते हैं। तो क्योंकि ये डिजीज नेचर है, जो रोग जिस गति से आती है उसी गति से शरीर से भी जाती भी है। और वेट अगर वॉच किया जाए और पेशेंस रखा जाए तो हम होम्योपैथ हर एक अच्छी जगह पर सफलता प्राप्त कर सकते हैं सर।
बहुत अच्छा आपने बताया कि जैसे आता है वैसे जाता है
जी,
हम लोग को सीखना पड़ेगा, क्योंकि और डॉक्टर इसमें डॉक्टर का पेशेंस बहुत बड़ा काम करता है।
जी हाँ सर।
हाँ, और आने जाने का कहानी जो है तो उस पर मैं एक बताऊं कि बड़ा जल्दी भी ठीक होता है और बड़ा देरी से भी ठीक होता है। एक स्कॉर्पियन के स्कॉर्पियन बिच्छे जो काटते हैं ना, उसमें मैंने देखा एपिस मेलिफिका बहुत अच्छा काम करता है। और मैं एपिस मेलिफिका का 0/7 पोटेंसी या नहीं तो 10m पोटेंसी मैं देता हूं। और इस पे जानते हैं कितना आप कितना उम्मीद कर सकते हैं कितना देरी में दर्द जाएगा। पेन किलर खाएंगे, डाइजेस्ट करेंगे, उसमें समय लगेगा, 1-1.5 घंटा तो लग ही जाएगा।
जी जी,
एपिस मेलिफिका 10m को मैंने काम करते देखा विदिन 4 to 5 मिनट्स।
बिल्कुल बिल्कुल,
सारा पेन वैनिश हो जाता है। इसी तरह से नेट्रम म्यूरिटिकम भी सारा पेन को इस तरह से याद कर देता है। बहुत अच्छा है प्रेजेंटेशन श्वेता जी।
श्वेता जी का प्रेजेंटेशन अच्छा रहा, अच्छा रहा, बहुत अच्छी प्रेजेंटेशन की। हाँ
डॉक्टर राम प्रवेश जी, आपको भी कुछ बोलना है तो बता दीजिए।
नमस्कार, सभी को प्रणाम। हमारे विद्वान चिकित्सक, अनुभव चिकित्सक डॉक्टर कल्याण स्वरूप जी बोले हैं, बहुत अच्छा है। चर्म रोग पर श्वेता जी के बहुत अच्छा प्रेजेंटेशन रहा। केस तो मार्वेलस था, कोई दिक्कत नहीं था, और इतना बढ़िया ट्रीट की है। जैसे सीपिया जो था रिंग बर्न में और इन्होंने सल्फर दिया, बहुत अच्छा किया और ठीक हो गया। धन्यवाद देते हैं हम श्वेता जी को। इसी तरह से मल्टीपल फैला, कम से कम सैकड़ों, 1-2 नहीं था, शरीर में समूचा था। मैंने दवा था बहुत सा, लेकिन हमने सल्फर 1 डोज दिया और 3 डोज छूजा दिया। 1 महीना के अंदर समूचा सैकड़ों खत्म हो गया, एकदम स्वस्थ हो गया। तो होम्योपैथिक में 2 चीज हम देखे चर्म रोग के इलाज में। रोगी को धैर्य होना चाहिए, रोगी नहीं होगा, और डॉक्टर को भी धैर्य होना चाहिए। बहुत
हो गया
जी, बहुत अच्छा, ठीक, धन्यवाद।
डॉक्टर हरिहरन जी, डॉक्टर हरिहरन, यू आर हियर? डॉक्टर हरिहरन,
I am here, sir.
बात करना? हाँ, yes sir, now you can talk sir, you can talk sir.
Okay, madam.
And you will also be presenting the vote of thanks.
Okay, madam, your class is very nice. Homeopathic way of prescription of a homeo doctor. It is a classical way. Really, I am appreciating you. And see, I am appreciating because you gave only single dose. Only single dose, and that you achieved the targets. In almost all, except see 30 potency you used for except see natrammo, except natrammo. I think natrammo 200 you are used because of that mind prescription.
Yes, sir.
I think it's so. I think it's so.
Yes,
Anyway,
that is right.
Anyway, your prescription is very nice. See, please come to our English session also. And sir, Sahani sir, I like.
He is the speaker for the English. He has spoken in the English session also.
Yes.
He has already spoken sometimes. So
Okay.
with this, I think, sir, we should. The time is up. Dr. Hubert is waiting for us, and now it is the time to conclude our Hindi session. थैंक यू डॉक्टर श्वेता जी, आपने बहुत अच्छा प्रेजेंटेशन किया। फिर इसी तरह से कुछ लेकर के आइए, हम लोग कुछ आपस में डिस्कस करेंगे, कुछ सीखेंगे और कुछ लोग शेयर करेंगे। हम लोग ये काम चलता रहेगा। कल हम लोगों के लिए आ रहे हैं डॉक्टर कौशल कुमार सवेरा, जो कि आपको ड्रग प्रूविंग के हिस्टोरिकल प्रेजेंटेशंस के लिए सीनियर साइंटिफिक रिसर्च ऑफिसर हैं कोट्टयम में, CCRH के तहत। ये कल हम लोगों को बताएंगे इसके विषय में, ड्रग प्रूविंग के विषय में। तो आप लोग जरूर से हिंदी सेशन में कल आप उनको सुनिए। और अभी इंग्लिश सेशन में डॉक्टर रुद्राक्षी डे आ रही हैं हेमिप्लेजिया के विषय में बता करके, तो आप लोग जो इसमें जरूर से सुनिए। रुद्राक्षी जी हम लोग के हिंदी सेशन में भी पहले बता चुकी हैं और इंग्लिश हिंदी सेशन में फिर आएंगी। तो नाउ द टाइम, थैंक यू टू ऑल। और इसके साथ में द हिंदी सेशन इज क्लोज एंड नाउ आई रिक्वेस्ट डॉक्टर हुबर्ट टू start his English session, sir.
Thank you, Sahani sir. And Shwetha Singh, very nice presentation, was a nice presentation.
Thank you so much.
Today is our 1197th day of uninterrupted daily webinar of IFPH, International Forum for Promoting Homeopathy, on 11th December 2023. Today our guest is Dr. RUDRAKHI Dey. Let us have an 1-minute silent prayer before starting our session. Thank you all. Dr. RUDRAKHI Dey.
Yes, sir.
Today, I told you that 1197th day. Now we are approaching to the 1200th day, 2-3 days after. Dr. RUDRAKHI Dey, Assistant Professor of Organ of Medicine. She is a BHMS MD holder, Homeopathy. Sri Swaminarayana Homeopathic Medical College, Halol, Gandhinagar, Gujarat, from our President, Prime Minister's home. Today she is dealing a subject, understanding hemiplegia from its miasmatic approach in homeopathy. We all fear a case of hemiplegia or paralysis. Anytime any person can affect paralysis. That is a dangerous condition. Nobody can say that I will not be a patient of paralysis. Nowadays, we can see that so many cases of paralytic conditions are coming after taking COVID vaccine, and we saw many patients are dying. And very sorry to say that after taking the COVID vaccination, so many people had paralysis, hemiplegia, and everything. That time, somebody feel that, oh, I am not died, only hemiplegia. So paralysis. So, doctor, today we wish you a very nice day for you to deliver a good speech. We're all waiting for you. You can start now. Now for the 45 minutes, your talk, and there will be a discussion after it. You are welcome, doctor. You can start now.
Thank you, sir. Good evening to everyone, to all my respected delegates and my seniors. Today, my topic is that understanding hemiplegia. Am I audible, sir?
Yes, yes.
Today my topic is, and I am very happy to share the screen and giving me the, and thanks to Midul Sani sir for giving me the platform for the second time to make understand that the understanding homoeplegia. I would like to share my screen.
Okay. Yeah. Fine.
Before to directly going to the disease, just we can see a diagram is also there, that what hemiplegia is. That it is a neurological condition, of course, condition characterized by paralysis and weakness of affecting one side of the body, that is the both the limbs, the upper limbs and the lower limbs. It can result from various underlying cause. The most common cause of hemiplegia is stroke syndrome and the brain injury, in tumor infections and congenital, and there are various, though rarest, congenital conditions where we can find hemiplegia. While conventional medicine offers treatment options, homeopathy provides alternative approach that aims to address the root cause of the disease. So the word plegia means weakness. So severely that near complete the hemi implies one side of the body, and hemiparesis is completely the paralysis of one half of the body, includes of arms, legs, and any disease or injury in the motor centers, brain can cause hemiplegia. Hemiplegia is more severe form, and hemiparesis where one half of the body is only weakened. So there is a difference between hemiplegia and hemiparesis also. People do make people do confuse themselves with hemiplegia and hemiparesis sometimes. But hemiparesis is weakening of the one side of the body, whereas hemiplegia is complete paralysis of one side of the body. It is also very different from conditions of paraplegia and quadriplegia. Paraplegia is quadriplegia, which is commonly confused with hemiplegia. Paraplegia is a paralysis in both legs, like both the lower limbs are affected, confused with hemiplegia. And the next is quadriplegia, below the neck, and also usually the results due to any injury, like any accidents, after any accidents or any fall from high spaces or any sudden injuries. This quadriplegia is mostly seen, though the chances of brain damage is more, but we can find quadriplegia in that cases. So what are the causes of hemiplegia? First we will discuss, and we will know. Many conditions give rise to hemiplegia. Generally, any injury to the right side of the brain will cause the left side hemiplegia. It is due to actually the pathology, as far if you go through the anatomy also, we can see that the pyramidal tract are crossing each other. So this is absolutely because of the reason that if the right side of the brain will cause left-sided stroke syndrome, whereas the left side will cause right-sided hemiplegia. Stroke is the most common cause of hemiplegia, and insufficient blood supply to the brain leads to loss of brain function. And stroke syndrome may also cause due to hypertension also. So it's not always the insufficient blood supply. It can cause the high hypertension in the blood vessels, may also cause stroke syndrome, caused by a clot formed in the blood vessels, that is atherosclerosis, and supply the thrombus. A thrombus away from its site of origin and forms a block elsewhere in the circulation as an embolus. A bleed from the blood vessels supplying the brain, and a hemorrhage, head injury also, and diabetes may also cause hemiplegia. Brain tumor infections, these are meningitis, encephalitis, and migraine syndrome. There is also these are migraine syndrome is the rarest categories and all. The recurrent headaches of severe intensity causes a complete sensation of the numbness and one half of the body. Inflammation of the blood vessels, that is vasculitis. Inflammation of the cerebral blood vessels actually, that causes vasculitis. Disease affecting the nerves like multiple sclerosis, acute necrotizing myelitis. Condition presenting from birth, that is cerebral palsy, lack of blood supply and damage in the nerve cell of the brain. We can find these in children's as well. Birth trauma and difficult labor, perinatal strokes in infants within 3 days of the birth can all cause cerebral palsy. So these are the causes of cerebral palsy, which may leads to hemiplegia and any injury. That is, in before we have seen that during deliveries, there are various forceps delivery can cause cerebral palsy. There are various traumas during delivery. Contracted pelvis can give injury to the baby and may cause cerebral palsy. Hereditary diseases like leukodystrophies. This is very rarest disorders affecting the myelin sheath, which covers and protect the nerve cells in the brain. And the condition usually appears in an infancy or a childhood. Now we will know about what are the symptoms of hemiplegia. How the patient will come to us with hemiplegia. Injury or insults in the brain cell that controls the movement of one half of the body causes hemiplegia, and hence the symptom largely depends upon the part of the brain affected, and the same can be said about the severity of the individual symptoms. See, it is hemiplegia is not like I got a stroke syndrome today, or if a patient got a stroke today, the type of severity of the paralytic condition of my limbs, of that patient limb, it will be far more different when the patient will be like 5 months from the stroke syndromes. So the severity of the disease, it actually differs from individual to individuals. Difficulty in walking, of course, because there will be paralysis. Problem in balance, losses balance when trying to walk. Difficulty in swallowing, as because of the total paralysis of the body, the difficulty in swallowing also, the nerve sensation will be gone. The trouble with vision, blurred vision, only in the affected side. This is only in the affected side of the eye, that is the trouble is vision. Like if a right side of the patient having hemiplegia, the right eye will be affected. The speech becomes difficult. Right side of the face, as the right side of the facial trigeminal nerves are also paralyzed. Numbness and tingling sensation, loss of sensation in one half of the body, loss of control over the bladder and bowel movement. So the bladder and bowel movements will be all involuntary, and inability to hold the stool or urine, and unable to perform tasks like holding an object, tie laces, as the totally motor neurons are damaged, and the muscles strength are also damaged. This is known as laxity of the muscles, and oneself buttoning, feeling depressed, heightened emotional sensibility with the inability to handle stressful situation. Memory seems to past events and concerning people. Sometimes it may lead to memory losses also. The presentation symptoms of the patient, or of which the side of the brain is damaged. Right-sided hemiplegia is caused by the damage of left hemisphere, while the left hemiplegia is its vice versa. And left hemiplegia often presents itself after the right cerebral hemisphere damage, and it usually presents with SLUPI, the loss of control over the purposeful movements, and unable to use objects correctly, and unable to draw and comb hair, because it is like unable to hold the hands, or if a person is not able to hold an object, he can't get. So these are the things we have been found in the patients of hemiplegia. So these are the presenting symptoms of hemiplegia actually. Then yawning, fatigue, appearing very exhausted. Pure hemiplegia has to be differentiated from alternating hemiplegia, which affects the children. True, rarely rare, and this condition has recurring episodes of weakness in one half of the body and alternating with periods when there are no weakness. During an attack, the child may suffer from many symptoms of a stroke, and they may develop long-term sequelae and the movement disorders, behavioral problem. And this is actually pure hemiplegia. There is a thin line difference between a pure hemiplegia and an alternating hemiplegia. Alternating hemiplegia is sometimes through relatively this condition has recurring episodes and a weakness of one half of the body. That is like hemiperiasis. We can say it is as an hemiperiasis also. So how hemiplegia we will diagnose? How? Doctor may wants that these are the procedures of hemiplegia, like total blood counts, blood chemistry test, cranial CT test. Of course, CT MRI is the surest form diagnosis, surest investigation for the diagnosis of hemiplegia. X-ray and EEG, that is electroencephalogram, and can measure the nerve activity within the brain. How to prevent hemiplegia, like how we can prevent hemiplegia. First, the first hemiplegia is like it is caused by cerebral palsy in non-progressive and does not deteriorate with the aging. But conditions like alternating hemiplegia, that is also known as hemiperiasis, can have serious consequences as the child is having repeated attacks. Exposure to high as well as cold temperature, emotional stress, and physical fatigue and bathing and infection, especially respiratory system, is known as triggering the alternating hemiplegia. Finding a specific triggers or avoiding them can help in preventing the long-term sequelae that usually develops hemiplegia. Hemiplegia usually takes a while to recover. There are two phases or to treat the conditions. Check for the further underlying causes. We must be keeping in mind that this may be the causes. Hemiplegia, that is rehabilitation and control of disabilities. Hemiplegia is often non-progressive, and many available measures make coping with less stressful to the person affected as well as caregivers. Neuromuscular electric stimulation, NEMS, high intensity electrical stimulation, is a proven way to maintain the size and even the function in muscles. And in muscles that must temporarily take a complete break from activity. The right kind of electrical stimulation can keep muscles relatively and sounds even when they are not being stimulated by the nerves or engaging in a real activity. So these are the treatments in these are the treatments for the hemiplegia. This botulinum injection, these are the modern medicinal treatments for alternating and hemiplegia. See, this is the gait of hemiplegia. This is hemiplegic gait. See, there is paralysis of totally complete paralysis of one half of the body, and we can see there are different gaits. This is a gait for Parkinsonism disease because there is no the center of aura. Parkinsonism is a patient can fall from there to there, and this is also this is cerebral ataxia. This is the gait is different here, and this is foot drop, and this is sensory ataxia, and this is the gait of hemiplegia, that is complete stiffness of one side of the body. This is the gait of hemiplegia. We can see in old age patient or any patient related to hemiplegia. Now coming to the homeopathic approach. My topic is today miasmatic approach of hemiplegia. First, I will start with that the theory of miasm actually we got from Hahnemann's in his chronic disease, which has been published in 1928 when he was in his 70s. Based on his observation, the lifetime in medicine as doctor, then homeopaths, the book asks profound questions and paper to represent Hahnemann miasm theory and shed lights on historical developments and following 100 years through the writings of the old masters and re-evaluate miasm's theory and practices. Homeopathy considers health states and harmonious functioning of life force energy and deviation from health, which develops when the life force overcomes the obstruction, that is a disease. And when the vital force deranges, the disease comes. And total response of organisms to adverse the environmental factors, internal or external conditions, and constitutional factors and inheritance or acquired. So now here comes to diagnose diseases like hemiplegia or any central nervous diseases, CNS, any disease related to central nervous system. So we need to go through we need to study a backward studies. Like if I take the most common cause of hemiplegia, the main is stroke syndrome. And why it is stroke syndrome? Because increase in blood pressure. And the most common cause of stroke syndrome is hypertension. So I can take hypertension as a mathematic approach for hemiplegia, or the pathology behind hypertension will give me the different mathematic approach of hypertension. And if I take only paralysis of hemiplegia, if I take the paralysis, how the paralysis have happened to that person? What is the pathology behind it? What are the conditions of that person? What are the temperament of that person that leaded to stroke syndrome of that patient? It could be any injury, though injury don't have any mathematic approach, but this is an accidental case. But in most of the cases, like stroke syndrome, the most common cause is hypertension. Hypertension has a mathematic approach. We can approach hypertension in different mathematic approaches. This trends true for all the diseases, including hypertension. Thus, in a case of hypertension, so here I took hypertension as a most common cause for stroke syndrome. So there I have diagnosed, or I have evaluates the various symptoms of hypertension, various manifestations of hypertensions in different mathematic approach. As homeopathy focuses on the patients with the hypertension rather than hypertension itself. Same with homeopathy focuses on the patient. So we need to find out the cause, why hemiplegia is happening, like ciset affectus, ciset causa, as that said by our handyman only. If I find the cause, the symptoms are removed. So if I find the cause, I need to diagnose the cause in mathematic approaches. So here I have evaluated the hypertension and in different mathematic approaches as a cause of hemiplegia. Totality of various characters, signs and symptoms exhibit the patient leads to homeopath to the similar remedy, and the remedy relieves totality of symptoms with the symptoms of evaluate blood pressures. Hypertension in a mathematic influences, like exacerbating factors like high salt intake. It is, we can see in a pseudosoric trait, like desire for salt. And an obesity tendency for obesity is psychotic, tendency to get obese, and that also cause hypertension. High fat intake, desire for fat is pseudosoric, and alcohol consumptions, desire for alcohol in pseudosoric. Like psychological factors and tendency to be affected by suppressed emotions and grief is soric. Like these are the mathematic different approaches of hypertension, exacerbating factors and high salt intake. As we know that soric patients has a tendency of high salt intake. We can see in drugs anatramure. Obesity tendency for obesity is psychotic, like Grauch-Bell constitution, we know in psychosis. High fat intake, we know in pseudosoric patient, like desire to take fatty foods. Alcohol consumption, like desire for alcohol in pseudosoric patient. And psychological factors are tendency to be affected in suppressed emotions and grief. Like we can see in a patient having these being stressed up or in tension for so many days, or any businessmen and all, and at night they got a stroke syndrome. But if we go on the pathology, that we will find that the hypertension was a maintaining cause there. So the exciting cause may be the suppressed emotion or a grief, but the maintaining cause was the hypertension, and the fundamental cause is absolutely the miasms. The sorrow is soric. Like soric patients are more irritable, more affected to any emotional disturbance. So these are found in soric patients. And continuing my pathogenesis and pathology, the initial phase and development of hypertension is due to hyperactivity of the vascular nervous system is an soric trait, because hyperactivity of a person or hyperactivity of any nervous system is an soric trait. Later on, hypertrophic changes occurs in the walls of arteries and atherosclerosis, and sclerotic changes that occurs in advances, and these represent arteriosclerosis. Like sclerotic changes also occur as an age advances, and these represent psychotic. See, I do take this as in classes also, and I have seen patient also. Like if I take atherosclerosis, what is the pathology of atherosclerosis? Like something extra growth is happening, something is thrombus, the emboli, the atherosclerosis is occluding my blood vessels. So it is an overgrowth or making an blockage to supply of the blood, and this is a tendency of an psychotic trait. And the malignant hypertension and predominant pathology is necrosis of the arterioles. There are various diseases, and the hypertension or the strokes or hypertension lead to stroke syndromes. The malignant hypertension having a necrosis of an arteriosclerosis, showing a clear influences of an syphilitic miasms. While treating the disease with multiple miasmatic influences, disease like hypertension, hemiplegia, it is important that remedy selected corresponds to the dominant miasm. This is very found to be soric miasm. In aphorism 80 of Organon of Medicine, afterwards, the dormant syphilitic or psychotic miasm, as the case may be, the manifest itself and may call for appropriate changes in the remedy. And even in predominantly soric cases, several antisoric remedies may be required, each one homeopathically chosen in consonance with the group of symptoms remaining after completion of action of the previous remedy. Aphorism 171, Organon of Medicine. Next, before going to that, I would like to take you to a patient. This is a patient on my OPD, and you can see the posture of that lady. This is the paralytic hand, and she couldn't sit properly. This is totally hemiplegic patient having these symptoms. She is 59 years old, and she got hemiplegia from injury. But her maintaining cause was, of course, hypertension. The next is, which homeopathy medicines give the best results for hemiplegia? We have seen in our OPDs, and there are many cases of hemiplegia. Homeopathy medicines cannot cure hemiplegia, of course. However, the medicines can be administered to improve the state of paralysis and improve blood circulations, and helps control and loss of power, and improve the power of muscles to some extent, and improve the overall health of the patient. Some common medicines for hemiplegia and such states of paralysis are plumbum metallicum. So these are the most commonest medicine we are using in case of hemiplegia, or I have seen in my respected teachers OPDs from the college OPDs and my own practices also. Plumbum metallicum is a great medicine in case of hemiplegia, this medicine is source of progressing and potentizing in metal leads. It helps the neuromuscular system of the body. It administered with the intention to improve some muscles power. Plumbum met, as it called, by indicating all kinds of paralysis such as hemiplegia, paraplegia, and quadriplegia. As said earlier, it cannot cure paralysis as such. This is Plumbamate. Plumbamate in Plumbamate 200 or Plumbamate 1M can give a good result in cases of hemiplegia. Next is causticum. Causticum is a great remedy in cases of central nervous system diseases. I got a patient, I remember, during my beginning of practices. She was 35 years old and she came to me. I was actually searching the photos of her, but I got only one photos, but this is the photo is not supporting it, so I couldn't make you visualize that photos. That girl was having hemiplegia. That girl was having that paralysis of one leg and one hand, both the upper limbs, and she got it from when she was like 20 years old or something like that. She fall from her auto in an accident, and after that she got that paralyzed hemiplegia. And in that case I have given causticum to her, and it has given a great result. Causticum 200 I had prescribed her, and after that she had started she started feeling strength on her limbs. And the last she came to me when she had been of holding the objects and all. So this is a case of causticum I have experienced. Nux vomica, though Nux vomica doesn't sound in hemiplegia, but it can give in the early stage of hemiplegia, not after some months or years. Lathyriosis sativus. This is an rare sound medicine, but we do use sometimes. This is another example of toxin transformed to the medicine. It is safe that there are some spasticity and stiffness in hemiplegia, stiffness in some muscles in the cases of hemiplegia where lathyrus may be called for. Next is gelsemium. As we know that gelsemium is great in cases of trembling of muscles and all. 3 Ds of gelsemiums. These plants is useful. Gelsemium is prepared useful in early case of paralysis, including hemiplegia. It is supposed to improve muscle strength in cases of paralysis. This is the patient case. I would like to say more also. If I have seen this patient, no. This patient, I have prescribed her medurinum, and with this, she's still under treatment, but she is showing me a good response in that. In this, I have prescribed medurinum in cases of some antipsoric on basis of the miasmatic prescription, obviously, because the cause behind her was atherosclerosis. Atherosclerosis is the occlusions of the blood vessels. Occlusion of the blood vessels is a psychotic trait. And by studying, of course, totality of the symptoms and generalities and all, the medurinum has came. So I have been prescribing on medurinum. The next is, which homeopathy is the best for hemiplegia? That is medicines. Arnica is, we can use arnica also, because arnica is a remedy for any injury, and the remedy is often used for post-stroke hemiplegia, where there is muscle weakness and stiffness and breast sensation. It may also help and reduces swelling and promote the healing of injured tissues. Lachesis is suited for hemiplegia, where there is sense of constipation, constrictions, and difficulty in swallowing. The left-sided paralysis, and it may also benefit individuals who experiences the speech difficulties. Like, as we know in lachesis, there is in lachesis, you can see there is locality of the patient, and during the speech difficulties also, we can see lachesis with a very good result. Cicuterosa also can be used, because in cases of hemiplegia, in the initial stage of hemiplegia, it could be a cause of convulsions and all. We can use cupramate also, because as I have told my earlier things, that hemiplegia also gives sometimes in children. It comes for some periodic attacks. So if convulsion is coming on periodic attacks, we can go for cuprametlacum, and we can think of cicuta virosa also, because cuprametlacum is a great convulsion remedy. Now I will share more, of course, for the hemiplegia. Hemiplegia in cases, I personally believe that if we take prescriptions, we can easily find the cause of the disease. And if we go a bit backwards of the disease, we can easily find out the miasms behind it. Like if I see that a patient is having irritability and irritations of the vessels, regarding irritability in his stress and anxiety also, his mental symptoms are also irritable, and of course patient will come to me after paralytic only. But as I know that it can't be cured totally, but I can manage the disease. Of course, the next physiotherapies and the massages, these are all helpful for hemiplegia to stimulate the muscles. With Arnica montana mother, external application for massage can also give a good result in cases of hemiplegia. And then if I go on the backward, that subsequent the, as I told before, the pathology behind hemiplegia is like atherosclerosis. So this is a psychotic thing. And see, if I go on like discussing the syphilitic things, and the hemiplegia will also be presented as an destruction of the blood vessels, and which is an syphilitic trait. Like syphilis is always destructive. Syphilitic patients are always destructive. So coming to the conclusion for hemiplegia, actually this is not a conclusion. Homeopathy provides supportive treatments, but I will, before concluding, I will like to mention, I will like to sum up my presentation in a way, like we, first of all, totality of symptoms for hemiplegia is a much needed. And we can't simply based on pathology or simply based on any particular cause or any investigations, we can't prescribe medicine. Like somebody told me to prescribe hemiplegia, and it will not work in that patient also, because homeopathy always goes for individualistic approach. We need to take the case take properly. We need to diagnose the miasm for hemiplegia, and for diagnosing the miasms, we need to do a very backward study of the disease, like why it is happening, why the stroke syndrome is happening, why cause of that stroke of that. This will help me to diagnose the miasmatic diagnosis. We get a good result in miasmatic diagnosis and in cases of miasmatic prescriptions also, because chronic disease are not chronic disease are not cured in one day. It needs time. Of patient have to be very patient, and as our handyman said, that patience in an eminent degree of the physicians. The physicians need also to be very patient. And in cases of 50 millisimal potency also, the case, if I give 50 millisimal potencies also in cases of hemiplegia, it still gives a good result. It's not like that you, for an chronic disease, I need to prescribe high potencies, like no source needs to be prescribed in high potencies. But 50 millisimal potency, like medorinum, this patient I have shown, I have been prescribing her medorinum 0/1, 0/2, and she is under the this 50 millisimal potency and giving me a good results. Hopefully one day I will show you her video of like walking joyously. hopefully for that. And now I will like summing up my presentation today. Like homeopathy provides supportive treatments and prevents deteriorations and non-progressive hemiplegia. In a remedy well to homeopathy treatment and homeopathy medicine, paralytic miasms from further degenerations. As we know that the paralytic muscles of the further degenerations in the medical signals impulse from the nerves to the muscles. Moreover, homeopathy acts without any side effects in an excellent available therapy measures. Excellent therapy measures need to have some therapies, physiotherapy, if we prescribe them, medicines, additional advices like physiotherapies, then it will give us a good result, because nervous stimulation and nervous practices need to be done. Without that, it is not like hand in hand with our prescriptions and all. So this is my presentation today. Hopefully I have completed on time.
Thank you, doctor. Very nice presentation.
Thank you, sir.
Yeah, you've gone through all the miasmatic background, how it is created and how the development of the cases are all nice, very nice to see. Now, there are so many, I think that many people have doubts about your cases. What is doctor, you can see, whether you can see any cases of after COVID or paralytic conditions?
Yes, sir. As you told it before, I had discussed it actually.
Please close the share screen option. Then after that. Okay. Yes. I have many cases. I got many cases of paralytic conditions in the first stage. Because if we are treating within, if or not within hours, if the conditions are coming very suddenly, that time if we can do many things, I think that complete recovery will be possible if we are giving medicines like arnica, calcarea carb, and calcarea floor. These are the three medicines I saw in many cases very useful. So I think that as if first aid medicines, it can completely cure such cases. I got one case a few months back, a 87 years lady. She was hemiplegia developed, and that time I gave this arnica, calcarea carb, and calcarea floor. Very frequently I got, then magnesia phosphate or MAC-phos is also very useful in such cases. If we are using these three medicines, I think that I had many experiences, so I can say that complete recovery. I got, most of the people are after 80s. But they are 87 years. I told you that one case was 87 years. That was also completely cured. She is now okay. Within, I say that only I got only 500 rupees. If such a case, I immediately sent her that I gave her medicine and I told her that you have to continue the medicine. They are very poor people. I told them, you go to the other hospitals, other medical colleges or any hospitals. So they went there and I told that they will do nothing for your age and your conditions and your financial conditions and everything. They cannot do anything. So you have to continue our medicines. After 2 days, she became okay. Only taken medicine for a few days. Complete recovery I got. She is now living with very pleasant and very healthy living. She is now doing. So that is what I have to say. Now, Dr. Hariharan is
in case of cerebrovascular attacks, also arnica acts very good.
Yeah.
Like if we give recently to one patient, one of my friend's mother has got, like, we were in third year studying VHMS, and suddenly she called. She was in class, and then a call came that her mother is injured and fallen from a bike. So our sir told her that so she was in under observation for 48 hours, 72 hours, like that. And during that time, like dropping of arnica has been given through her lips and all. And she, after like 72 hours was the observation, and she recovered at 48 hours.
Yeah.
And we had an idea, and we are in second VHMS. We all went to that hospitals to see auntie, and that time we had an idea that the nurse will not she will not allow that homeopathy medicine to be given, and we had given 500 rupees to her to give the medicines, and she has been recovered like 72 hours, and she got senses, and the observation completed at 48 hours. She's absolutely fine. Within 1 month she was absolutely fine. Out of doctor told that your condition was on totally danger, but how you have recovered. So this is the magic, or I can say that, of Arnica montana. Arnica montana is this is a very miraculous drug.
Yeah. Then Natroself also, Natroself 50
Yes,
is
head
also
injury.
for head injury and that condition. Now, Dr. Hariharan, please. Doctor, you can talk now.
Okay, madam. Your class is very good. Really appreciating you. First of all, then it is one of my doubt is that see, right side paralysis is happening due to the left side of the brain injury and vice versa. And while we are taking the case, which inside of the body, which side you will take? Affected side. Suppose a patient is having left-sided paralysis and it is affecting the right side of the brain, and see, while we are taking the case, which side you will take? Right side will take, or left side ailment you will take?
Sir, of course, according to the symptom presentation, subjective symptoms and objective symptoms of the patient, the physician will take that. If the patient is right-sided, the thing is, if the cause is on the right side, the symptom presented will be on the left side.
Yeah. Then which side ailment
And
you will take?
we need to take the left side, sir, not on the right side, because subjective symptoms. But if we go on the studying of the cause, we will find that it is a right-sided cause.
Doctor, actually the ailment happens on right side. So we must take the, not take the left side, but we must take the right side ailment. It is my opinion. I don't know. See, you are all very expert in that, because it is my doubt. By hemiplegia cases I am treating, and partial cure, I am getting partial cure only, not complete cure. But we can get about 60-70%, we can make it cure, but totally it is very difficult. And sometimes you will get, yes, if a sudden thing happens, a sudden injury happens, we can give arnica or some other medicine and we can recover. But in chronic cases, it is the doubt, it is my doubt that which side we will take while we are taking the case. That is my question. You says that if the right side is, if the left side is paralyzed, we must take the case left side itself.
I didn't say it, sir. It is studied and it is shown in the modern science, and it is explained in the practice of medicine also, sir.
But in homeopathic, I think you must take the reverse. See, left side, in case left side, we must take the ailment is in right side. It is my opinion. You think it so? You think about it. and say the result to me the next class.
Sir, it
Sir,
was a-
question is very nice.
Question is very nice. Because such questions are always come from different angles. So we have to answer this. Shall we say one answer for a small description about it? My opinion, I can say, isn't it? Because we are taking cases, we know that if a medicine is drug proving, we are always connecting with the drug proving, isn't it? And homeopathic medicines are proved, and homeopathic medicines are, if it is if there is any damage in the right side, it may affect the left side. So if the medicine, if we take that time, that medicine is having the quality of producing at the same time causing difficult destruction of one part, and the opposite part will be affected. That is the medicine may be there. So that medicine we may select. That is my opinion.
But in my practice, I will not give the medicine like this. I will give only the opposite side brain affection. Then I will take, when I am taking the case, the left side is ailment is it happens. I will take the brain in the head, right side ailment, right side injury. Right, then likewise I am taking the cases. So please, doctor, your class is very nice and you are very intelligent. You see, so you think about it, and it is my opinion.
Sir, actually, you are. If I go through organon of medicine, according to our Master Hahnemann, the first prescription, second prescription, if I firstly see the most trivial symptoms of the patient, it will go on the side affected of the patient. And then if I study more, I can find the maintaining cause behind it. I can find the exciting cause behind it. And then I can prescribe also according to the cause of that disease. So it can be both, sir. If you ask me, my view will be like that. First, I will think about the most trivial symptom of the patient. As our Hahnemann said, that we have to most trivial symptom based on prescriptions. And after that, the cause of the disease. So, sir, this is my views on your answer. Your questions, sorry.
Okay, good. Dr. Ramexi, anyway, your class is good, but a lot of doubts regarding about it, that hemiplegia. See, hemiplegia is happening in just in one day, not happening in just one day.
No, not in a one day. It is not an one-day disease.
It is not an one-day disease. It has
absolutely.
See, the after psoriatic and psychotic, then syphilitic. That is the we know the chronological order of the development of the disease. We know
MIASMATIC disease.
So treating a hemiplegia case is very, very difficult. If the symptoms goes to from psychotic to psoriatic, we can say the patient is getting curing.
Yeah, otherwise, same, exactly, sir. Any more queries?
One Dr. Raju. No. Complete curing of hemiplegia is very difficult. I think it's so.
Yeah, it is, sir. It is. Like it isn't maintained. We can maintain the disease. We can maintain the patient. But 2 + 4 cure is difficult.
Very difficult. We can see give him the physiotherapy.
Yeah, I told. Yeah.
That only that method is.
Sir, actually, it also depends on the severity of the patient or of the disease that coming to me.
Okay, very correct.
At which condition the patient is coming, what is the cause behind it,
Say-
how the disease has been to her for the last years, or if a patient come to me and hemiplegic for last 10 years, so it will take time, or maybe it can my fail case also. Couldn't in this case also.
Like you are well studied in neurological diseases. I have one question. That Bell's palsy is due to
Yes, yes, I was about to tell. I missed that point. Yes, Bell's palsy. This is very common, and that temporomandibular paralysis also.
Mandibular paralysis. That which nerve it happens? Mandibular nerve.
Trigeminal nerves.
Trigeminal nerve. From where that trigeminal nerve arises?
Sir, these are the cranial
No,
nerves of
doctor.
the brain.
I am stopping, doctor. See, the time is, we have the time, so I am asking such questions. Okay, doctor, very good.
Thank you, sir. Thank you, sir.
While asking such questions, many of the people may hear. If they don't know, then they will understand that they can remember the things. If you are asking such questions, that is why we are asking, not for checking.
Yes,
not for checking. You don't think that. Because we have to refresh our knowledge. If you are saying that how the branches are going and how it may be affected, then we can hear from you that everything. Some other doctors will otherwise say something. So we will get more knowledge. That is why we are always thinking that we have to get more knowledge in each and every moment we are here.
Sorry, doctor. Sorry, because it is the out of the way question. So very sorry.
No, sir. No need to be sorry. I felt like a revision of my chapters.
But I am asking you whether there is any dental, in conditions of dental procedures, dental surgery and everything, that time, if there are any chances for these type of paralysis, because they are using medicines, the anesthetics and with adrenaline, that time, whether it may affect the such conditions, paraplegia or local anesthesia, local problems.
The wrong dose may be affected if they don't know that the patient is having the severe conditions before. Like, sir, a thyroid problem, patients could get affected by this. Like or like diabetic patients, those who are diabetic, highly diabetic patients can lead to hemiplegia if they are not treated in cases of dental surgery or with adrenaline and all.
Because there is two methods in taking this the dental surgery. They are doing nerve blocks and infiltration methods. These are the two methods they are giving anesthesia for dental complaints. That's one complaint. In certain cases, nerve blocks are giving. That time trigeminal nerves will be affected. That is why I am asking you whether there is any chances for that. I suspect there is chances for if the injury is there. We are doing that injury, making an injury by pricking that.
Sir, it can cause Bell's palsy, but it can't cause hemiplegia.
Yeah.
But that see, Bell's palsy is caused by some infection due to virus. See, it may happen due to the infection.
And some in winter also, cold can also cause Bell's palsy.
Such ailments. It is what dentists are doing is they are blocking the nerve only. When after some time, automatically the effect has gone and the patient become revived.
So that's why we are going to the time. So I am please, Doctor, say vote of thanks also, Dr. Hariran sir. We have to start our
doctor, one day you will become a very fine neurologist. No doubt in that, doctor.
Thank you, sir.
A blessing from a veteran doctor.
It is a blessing from IFBS. See,
Thank you.
Doctor, thank you very much on behalf of IF office bearers and see the fellow beings and myself in on my behalf also. I say thanks to you, Dr. Come again.
Thank
you,
you so
doctor.
much, sir. I would like to come again with some uncommon things so that I can discuss it
Okay, okay,
and get
very
some
nice.
good questions.